And back now with Sunday House Call. You know, the demand for erectile dysfunction drugs has soared recently, and with that, so have the number of fakes. So what should men be aware of, Dr. Samadi? I mean, you go on the internet, how do you know what you're getting is what you get?
You know, as a urologist, I deal with this all the time because a lot of my patients are having difficulty getting most of these medications. We're talking about Viagra, Cialis, and Levitra, and it's a lot cheaper when they get it from other countries. But what we are finding is that almost 80% of these medications are counterfeit. They have sheetrocks covered with wallpaper blue, and you cannot distinguish between the real pill and the fake ones. They have some boric acid and rat poisons. It's unbelievable, some of the things that it's in there. So the word of caution is really, if you are going to get any of these pills, the best thing is to get them here. But if you have to go online, you want to look for signs of VIPPS, the Internet Pharmacy. It's a verified Internet Pharmacy system where they really have certified pills, and that's what you want to get. You don't want randomly to really go out and get the pills from any kind of internet pharmacy.
The VIPPS, is that a website itself?
No. Whatever the site is, they have to have that sign, the seal on the side, to make sure that it's a real certified pharmacy online.
Doc,
I want to make a couple of points on this.
I want to ask you about rat poison.
Well, rat
getting sick?
So look, yes, and people can die from this. But here's the other point. Dr. Samadi is an expert at this. You want to go to a doctor like Dr. Samadi to figure out if you even need the pill. If you go online with some doctor you've never seen prescribing this, okay, you can find out if it's a certified pharmacy, but you can quickly get in trouble. And that's not just for these type of drugs. It's for all drugs. I'm against, in general, getting your medications via the internet. You need experts like Dr. Samadi to be prescribing for you.
Can you explain, Dr. Samadi, as an alternative to the medication, some men might not need erectile dysfunction drugs because their ED may be caused by something else. What?
It's actually diabetes plays a big role, hypertension. So what we're finding now is that ED in young men is the first sign of heart disease. That's a very important point that you brought up, and that's important because those arteries clog up, and when you see someone in their early 40s and 50s and they have this issue, you want to go straight to the heart and find out if they have any heart disease. You want to look into their family history, look at their blood pressure, and by just fixing that, putting them on a very aggressive diet and exercise regimen, you can fix that, and next thing you know, they're doing much better. So your point is well taken. You also want to make sure the interaction with some of these medications with other medications, you know, so there's a communication between the experts, specialists, and the medical doctors to make sure the patients do well.
Come to me for your blood pressure. Go to Dr. Samadi for your erectile dysfunction. Stay away from the internet.
Okay, very good.
All right.